Good morning. My name is Jody Burton, and I am a nurse at Hazelden Betty Ford Foundation and a member of the Minnesota Nurses Association. Let's face it, no nurse takes walking away from bedside lightly. Today we are here to begin our unfair labor practice strike. For those of us who have dedicated our careers to caring for people battling addiction and mental health challenges, making this decision is one of the most difficult decisions we've ever faced. We love our patients. We love the work we do. This is exactly why we are fighting. Our employer has repeatedly committed unfair labor practices, including failing to bargain with our union after making unilateral changes to our working conditions and treating us differently related to our protective union activity. For nearly a year, we have been bargaining for a first union contract. From our perspective, Progressive has been painfully slow, with only a limited number of proposals agreed, while many of our issues, the most important issues that patients remain unresolved. Our patients deserve better. Addiction treatment is unlike most any other areas of healthcare. Patients arrive frightened, intoxicated, withdrawing from drugs and alcohol, experiencing severe mental health symptoms, or unsure if they even want to be here. These are some of the most vulnerable moments of a person's life. Safe, compassionate nursing care provided by experienced nurses can make the difference between someone giving up and someone beginning their journey of recovery. That level of care cannot simply be replaced overnight. Many of us have spent years, some decades, learning addiction treatment, understanding Hazelden's unique protocols, building relationships with our patients, and recognizing subtle changes that can prevent emergencies before they even happen. Experience matters. Continuity of care matters, and trust matters. As someone who has worked at Hazelden Betty Ford for more than a decade, I have watched the culture change. There was a time when nursing voices were actively included in conversations about patient safety, staffing, and appropriate nursing to patient ratios. Today, many of us feel those frontline voices are no longer given the same weight and respect, and that financial priorities have increasingly overshadowed the experience of the nurses providing that direct patient care. We want to be crystal clear. We are not asking for anything extraordinary. We deserve a fair first contract that includes retaining and recruiting experienced nurses, safe staffing, on-site security measures to protect staff and patients, quality benefits, and a fair treatment. These are the same things healthcare workers across the country seek because they directly impact patient care. Hazelden is spending substantial resources on temporary replacement nursing during our ULP strike. We believe these funds could instead be invested in retaining the experienced nurses who have cared for their community for years. This contract fight has always been about security protections that allow us to continue providing the exceptional care to our patients deserve while ensuring Hazelden Betty Ford remains a place where experienced nurses want to build their careers. Hazelden Betty Ford has earned a world-renowned reputation for excellence in addiction treatment. That reputation was built by dedicated professionals who have devoted their lives to this mission. We're calling on Hazelden to continue to invest in the experienced caregivers who helped build that legacy. To our patients, families, and community, we are asking for your support. Help us hold our employer accountable to stop the unfair labor practices. Nurses are ready to bargain during and after the UPL strike, but our employer must be ready to find meaningful solutions in good faith. We call on Hazelden to give nurses a fair first contract that prioritizes patient and frontline worker safety. Every day this contract fight continues is another day spent away from our patients we desperately want to serve. We do not want to stand out here We want to stand at bedside. We are ready to return. We are ready to care for our patients, but our employer must also be willing to deliver on the solutions that keep us at bedside and safe. It's time to finish this contract, get back to work, because that's what matters the most. Thank you.
Good morning, my name is Ann Pullman. I am a nurse at Hazelden Betty Ford Foundation in Center City and a member of the Minnesota Nurses Association. Nurses are standing here today because we have been pushed to the breaking point. This unfair labor practice strike represents nurses sounding the alarm. We are striking because Hazelden continues to commit unfair labor practices, including disparate treatment, retaliation related to union activity, and unilateral changes to our working conditions without bargaining. We have brought several issues to the bargaining table, including that vulnerable patients and frontline nurses are no longer safe on our campus. For too long, extreme physical, verbal, and sexual harassment has been an ongoing reality at Hazelden. Nurses have been stalked, hit, kicked, punched, and threatened. And what is management's response? No meaningful solutions like on-campus security. Instead, we have to call the sheriff's office, and at times, it takes them 20 minutes to show up. It is reactive, not proactive. While nurses are on this strike line, Hazelden is bringing in temporary nursing staff with security protections. The protections nurses have been bargaining for over the last year and still have not been met. Instead of protecting the healthcare workers who keep the institution running every day, hospital leadership has consistently prioritized protecting the Hazelden brand over employee and patient safety. Sweeping serious events under the rug and failing to ensure basic safety measures, such as adequate security personnel, proper staffing ratios, and working security cameras, is a direct failure of their duty to protect us. Even worse, management knowingly continues to readmit individuals with documented histories of abuse and violent behavior toward our staff and other patients. It is dangerous. Nearly 2 years ago, Hazelden started the Cohen program to admit patients with more serious mental health challenges. Since that program opened, behavioral emergencies, campus substance use, and violent incidents have skyrocketed. Let us be clear. Nurses believe in second chances. We believe in the power of recovery, but to rehabilitate people safely, we require structural support from management and on-campus security. We treat highly intoxicated, highly impulsive, angry, and hurting people to help them become mentally and physically stabilized. On a campus with over 300 patients, on-site security is not a luxury. It is an absolute necessity. Hazelden used to be affectionately called the Betty Bubble, a sanctuary free from outside violence, triggers, drugs, and alcohol. A safe place where people could gain coping skills and heal. That is the standard of care we are standing up and fighting for. Right now, we are severely understaffed, overworked, overwhelmed, and deeply fearful for our patients and frontline workers' safety. Nurses will give and give until they have nothing left, but we refuse to sacrifice our physical and psychosocial well-being. It is deeply disappointing that leadership is more concerned with public relations and the financial cost of on-site security than they are about the actual safety of the people on campus. So today, we stand here to call on Hazelden leadership as we demand a fair first contract. We are ready to return to the bargaining table during and after our ULP, unfair labor practice strike, but our employer must come to the table in good faith and guarantee a safe environment for everyone. Thank you.